In order to prevent cervical cancer, one should start taking cervical cancer vaccine or HPV vaccine so that you build the antibody to eliminate or counteract the virus when the virus invades you. Hi there, I'm Dr. Lim Ai Wei. I'm an obstetrician and gynecologist at Thomson Hospital Kota Damansara. I'm here to answer your questions about cervical cancer and HPV vaccination for cervical cancer protection. This is Ask the Doctor. Cervical cancer, known as the cancer of the neck of the womb, is a cancer that is part of a female reproductive organ. As you can see in this model in front of me, the reproductive organ consists of a womb, which is also known as the uterus. The lower part of the womb, over here where my finger is known as the cervix or neck of the womb. So, cervical cancer means it's the cancer of this particular area here. This cancer particularly affects ladies that have started having sexual intercourse. Therefore, it can happen at any range from the age of 20s all the way to the 60s or even 70s. Most of the time, cervical cancer is related to a virus known as human papillomavirus or HPV. HPV or human papillomavirus starts occurring when someone is sexually active. In order to prevent cervical cancer, one should start taking cervical cancer vaccine or HPV vaccine before they are sexually active, as it can prevent 95% of cervical cancer. However, the efficacy of that vaccine reduces after you are sexually active. So it's better to take it preventively before you have the virus so that you build the antibody to eliminate or counteract the virus when the virus invades you. As long as you have had sexual intercourse, you carry a risk of cervical cancer, irrespective of how many partners you have your entire life. But if you have multiple sexual partners, when I say multiple means at least more than 3, then the risk of getting cervical cancer definitely increases. But bear in mind, even though with only one single partner, you carry a risk of the virus, therefore you need to be screened. Personally, I won't feel that it is painful, but definitely it's an uncomfortable procedure. And we do have to insert something into your vagina in order to visualize the cervix or neck of the womb. The instrument to use looks like this, which is known as a speculum. And insertion of this instrument is the one that causes discomfort. However, the procedure only takes a few seconds, usually less than 5 seconds, and it would be done. If you are diagnosed with cervical cancer, we will check which stage you are before we determine whether you can continue the pregnancy. If you are at early stage, for example, stage 1, which is just confined within the cervix, we usually allow you to continue your pregnancy if you are near delivery, followed by proper treatment. However, if you are detected to have cervical cancer before you are pregnant, it also depends on the stage, but most of the time, we will request for you to prevent pregnancy first, get proper treatment before you embark in a pregnancy. Treatment for cervical cancer mainly involves surgery. Either we just remove the part that has the cervical cancer, or we will need to remove the area which is the neck of the womb or the cervix together with the whole entire reproductive organ depending on the age and the stage. After surgery, most of the ladies will need to go through another treatment which is known as radiotherapy, which will actually help to eliminate the remaining active cells that is inside and prevent it from becoming active lesions again. Therefore, radiotherapy might be the long-term treatment followed by routine smears, which is your pap smear, as a form of follow-up. In general, there is no cure for cancer. We as doctors can only help you treat the cancer and make sure that you do not go back into active cancer phase all over again. Every cancer will need long-term follow-up and every cancer will need long-term treatment. If you are interested in finding out more about Thomson Hospital's cancer treatment facilities, visit our website in the link below.